here with more on all of it, Trump economic advisor and former New York Lieutenant Governor Betsy McCaughey, along with Alan Colmes of Fox News Radio. Good to see both you guys.
Thank you. Hi, Alan.
Hello, Betsy.
So we had to keep you apart. We had to keep you apart.
No,
so
we actually have been dueling for many years, and we're good friends.
It would get interesting. All right. I'm concerned about this government option. What exactly do you think that means, Betsy? Are we going to find that so many insurers have exited that the government's the only game in town?
Well, the public option, so-called, is very bad news for seniors. And I'll tell you why. Because the public option will pay doctors more or less Medicare rates, or less. Mm-hmm. And already the number of doctors who are willing to take Medicare is limited. Mm-hmm. It's less than what commercial insurers pay. Mm-hmm. So seniors already have a hard time finding doctors willing to see them for those Medicare rates. They're calling and calling, trying to make appointments. Yeah. If you had millions more people on a public option trying to get to see the same number of doctors, the same doctors willing to take those low rates, seniors are never going to get seen.
Okay, so bad news for seniors.
Hammer for seniors.
And they're the ones that really need this.
Oh, yeah.
Alan, what happened to competition? What happened to having all the insurers compete for business? That's how it was supposed to work.
Well, you know, what the president originally wanted was a public plan to compete with private plans. He didn't get it. He actually took a Heritage Foundation, Republican-founded idea, and that's what he's doing. But look,
but the private plans are out. They're like, you know, I can't make any money at this. They're getting out of the business.
If I could finish my answer. Republicans keep talking about repeal and replace. Where's the replace part? The president has continually said, outreach, work with me, let's fix it. What Republican has taken him up on?
Actually, I'd like to answer that, Alan, because there are two very good replace plans. One is Donald Trump's plan, and the other, a very similar plan, is the House Republican plan. Just let me finish. And both of them would offer many of the things that people find attractive about Obamacare, like allowing children to stay on their parents' plan until 26.
Trump hasn't said that. Trump said he would totally repeal it. And what about the people with pre-existing conditions?
Please let me finish. The difference is this. The reason that Obamacare is collapsing is it tries to force healthy people to pay the same for insurance as chronically ill people. But chronically ill people need 10 times as much health care. And the result is that the premiums get very, very high to cover their needs, and the deductibles get very, very high because insurance companies know that whatever a healthy person pays in premium, none of that money can be spent on the healthy person. It all has to go to cover the sick person.
If someone could tell me what the
Let me just finish.
Okay.
So,
all right, Betsy, button it up and let Alan get his point in.
Right. So the House plan and the Trump plan create a separate pool for the chronically ill and subsidize it with everybody's tax dollars going in to help those people.
You said a number of things have been discredited. How are those death panels working out? There are no death panels. You claimed every 5 years people would meet with...
Alan, what about her point that she just brought up, that you have sort of this catastrophic insurance that people could get?
Look,
that's right.
Betsy, you have said there'd be death panels. You wrote an Atlantic piece and said people would not be allowed to buy additional health care.
I don't think we should be fighting between each other. I think we should be offering viewers
But I've not seen a solution from the Republicans. What is the replace part of repeal and replace?
She's offering one. She's saying the catastrophic type of insurance.
It would make sure that people with pre-existing conditions do get coverage, and that it's subsidized because it will cost more than healthy people's insurance. Mm-hmm. But it will also bring down the cost for healthy young people who want to buy insurance. Okay. Because it will be priced lower.
So, Alan, what's wrong with that?
Fine. But you know, Republicans so far have simply... All we have heard from the Republicans are, and Paul Ryan said he'd have a plan. We haven't heard it. I've heard repeal and replace. Betsy's candidate, Donald Trump, has said, I will just totally repeal every word.
No, he's got a plan, and it's in writing. It's in writing up on his website.
Betsy, I have to be able to finish the sentence.
Yeah.
Your candidate has said he would repeal every word of Obamacare. Mm-hmm. Republican after Republican has said they'd repeal every word of Obamacare without any replace. We've not heard the replace. Yeah.
No, but they've talked about ideas, and Betsy just pointed one out there. But, you know, look, we'll see. We'll see where it goes. I think the bottom line is we need to find some way to help people get health care, but it has to make economic sense.
Yes.
It does. Or it's going to collapse, and that's what we're witnessing right now.
Do we have time to talk about the penalties?
We don't.
Okay.
Next time, Betsy. Next time, Alan. Good to see you guys.
Thank you.